Hello, welcome to our next episode on hypertension education. You can check our previous videos if this is your first time of watching this channel. Let's continue from blood pressure ranges: normal, less than 120/80 mmHg, elevated, 120 to 129 systolic and less than 80 diastolic, hypertension stage 1. 130 to 139 systolic or 80 to 89 diastolic, hypertension stage 2. 140 or higher systolic or 90 or higher diastolic, hypertensive crisis, higher than 180 systolic or higher than 120 diastolic, according to Centers for Disease Control. The guidelines used to diagnose hypertension may differ from one healthcare provider to another. Some healthcare professionals diagnose patients with high blood pressure if their blood pressure is consistently 140/90 mmHg or higher. This limit is based on a guideline released in 2003 and another one was released in 2017, which is 130/80 mmHg or higher. The causes of hypertension can be categorized into two main types: primary hypertension and secondary hypertension. 1. Primary hypertension. This is the most common type of high blood pressure, and it develops over time with no specific identifiable cause. However, several factors increase the risk. Genetics, family history of hypertension makes it more likely to occur. Aging, blood vessels gradually lose flexibility with age, increasing blood pressure. Lifestyle factors, unhealthy diet, especially one high in salt, sodium, processed foods, and unhealthy fats. Physical inactivity, a sedentary lifestyle contributes to weight gain and weakened cardiovascular health. Before we continue, if you happily enjoy the video so far, hit subscribe and don't forget to turn on the notification button. Obesity, excess body weight puts strain on the heart and increases blood pressure. Alcohol and tobacco use, both can damage the cardiovascular system and raise blood pressure. Stress, chronic stress may increase blood pressure over time, especially if it leads to unhealthy coping habits. 2. Secondary hypertension. This type of hypertension results from an identifiable underlying medical condition. Common causes include kidney disease. Damaged kidneys cannot regulate blood pressure effectively. Hormonal disorders, hyperthyroidism or hypothyroidism. Imbalances in thyroid hormones can affect blood pressure. Cushing's syndrome. High cortisol levels can lead to high blood pressure. Aldosteronism. Excess production of the hormone aldosterone can cause sodium retention and increase blood pressure. Obstructive sleep apnea. Repeated interruptions in breathing during sleep can lead to high blood pressure. Certain medications. Overuse of nonsteroidal anti-inflammatory drugs, NSAIDs, certain decongestants, hormonal contraceptives, and some antidepressants can increase blood pressure. Substance use. Drugs like cocaine or amphetamines can cause spikes in blood pressure. Additional contributing factors: poor diet, high intake of sodium and low potassium can disrupt blood pressure regulation. Chronic conditions, diabetes, high cholesterol, and metabolic syndrome increase the risk of developing hypertension. Ethnicity. Some ethnic groups, such as African Americans, have a higher risk of hypertension due to genetic and lifestyle factors. Understanding and managing these risk factors through lifestyle changes, routine health checks, and in some cases, medication, can help in preventing or controlling hypertension. I will still urge you to subscribe to my channel for more health education like this, and thank you for watching. See you for our next episode.